as the protests and the shouting continue in town halls on how end-of-life care would be changed by healthcare reform, quietly, away from the furor, Mulvin Edwards and his wife are planning for the last days of his life.
Have the doctors told you what your prognosis is?
Well, they can't do nothing else for me. They can't. That's it.
They can't do anything else?
Yeah, they said they did all they could do.
Mulvin has bladder cancer, which has spread to his bones. He did not want to die in a hospital, so he chose home care through a hospice program.
I told him he had to make a decision because we don't know how long he's going to be.
Proponents of healthcare reform believe that if more terminally ill patients are given end-of-life counseling like Mulvin, they would be less likely to choose futile, expensive treatments.
Patients often get much more care than they actually want at the end of life.
It's estimated that 27% of Medicare's $327 billion budget is used by patients in the last year of life. That makes end-of-life spending an attractive target for cost-cutting. Yet the healthcare reform package that includes end-of-life counseling paid for by the government strikes some as inhumane and has proven politically toxic. The Senate version of healthcare reform has cut it out. The House version still has it in.
Is too much money being spent on end-of-life care?
Unfortunately, yes.
Dr. Carmine Giannatiempo treats terminally ill patients every day. He says by the time they get to the intensive care unit, it's too late for counseling.
Most of the time, the first time that the subject is actually brought up is when the patient is almost at the end of their life.
Some believe that when it comes to the terminally ill, more doctors need to stop prescribing and start communicating.
We are not honoring patients and their families' own wishes. It turns out that if we did a better job of actually informing patients about what their choices are and then honoring their wishes, we would save money.
And help more people like Mulvin and their families deal with death on their terms. Kelly Cobiella, CBS News, Paterson, New Jersey.